The lymphatic system in the body. So not only do we have the heart and blood going out of the heart through arteries and blood returning through veins, but there's a subset of blood called lymph. And it also travels through the system of the body, but relies on muscle for the pumping, the movement of lymph in the body. Now, lymph is basically the white blood cells carried in a medium around the body. Its main activity is the immune system. The white blood cells, they eat up and destroy the dead cells and things that are in the blood that shouldn't be there. Okay, so cells that are viruses or bacteria. So the white blood cells are key, both in the blood and in the lymph. So the lymphatic system consists of ducts which carry the lymph, and then along the lymph nodes, along the lymph ducts, there are nodes, many nodes, where there's an even greater concentration of white blood cells. These are often in the, so a lot are in the groin and a lot are in the armpits. Here in the neck, you might have experienced when a lymph node experiences an infection, it gets enlarged and there's more fluid, more lymph inside those nodes. Now, when somebody has treatment for cancer, very often they take out some of these lymph nodes because the cancer has grown into that immune system space. So we need to be constantly aware of lymph when dealing with someone with cancer. So once a patient has completed all of their surgeries and treatments, and they have been returned to the real world, but with fewer lymph nodes, there is always a possibility of what's called lymphedema. Lymphedema is where a limb, or actually it can actually happen in the body too, but very often you'll see it as an instructor in arms or in legs, as a puffiness, as a water retention, where it has grown in shape. And this is basically lymph inside the tissue of that part of the body that is not able to get out effectively. So lymphatic drainage is what we need. Now, if the lymph cannot be drained, then we see a buildup. Now, how can we as teachers cause this problem? And we can, okay? So let's just move on